overdose prevention site.
It's only a tent with some supplies inside, but the doctors behind this pop-up safe injection site say it's saving lives.
These are all of our harm reduction supplies and our overdose response and resuscitation equipment.
The pop-up site has been set up today right across from Nanaimo Regional General Hospital. On November 18, they tried to do this the first time on hospital property, but were kicked off by security and RCMP.
It has been 6 weeks since our initial action. It has been 6 weeks since our Minister of Health, Josie Osborne, has taken her position with the government. And in that time, every single day, 5 to 7 British Columbians have died a preventable death.
Now they're back stepping up the pressure on the Ministry of Health to put permanent overdose prevention sites inside all BC hospitals.
We are the experts in this field, and for some reason, we are not invited to the table where the decisions about the tools that I have access to as a physician are being decided upon.
6 years ago, I would have been totally against it.
Wanda LeBlanc's son has been a heavy drug user for the last 5 years, and she says he wouldn't be alive right now if it wasn't for overdose prevention sites.
A lot of people misunderstand what we're doing at the overdose protection site, and so we're not giving people drugs, we're testing people's drugs and allowing them to use when they're here in a safe place. You know, we have doctors, we have nurses.
They're trying to make the point that having overdose prevention sites right in hospitals with all the medical help in place makes more sense than scattering them around communities.
So this is not a hard project. This isn't an expensive project. It's a high-yield project that we need our government to act on.
The ministry doesn't sound like it's considering OPS in hospitals, but did release this statement to Check News today. The province is taking action to establish minimum service standards for OPS, as recommended by the Auditor General, to support consistent, quality care for people and a safe environment for workers. These standards will establish baseline operational and facility requirements for all provincially funded fixed and mobile OPS in BC. This work is ongoing, and we will provide an update as soon as we can in the new year.